and you found it like some yes
between the normal case and the
yeah, or for example an accidental case. So maybe that guy is perfect, but he met an accident and you notice that this particular bone doesn't look even, or it looks small, or whatever it is. So using measuring tool, you can measure basically what is the size of his bone. 26.05 mm. So by this you will have a basic idea that that nothing is wrong with his bone. It might be possible, or there is a abnormality in his birth. It might be possible, due to which they have problems and things like that. There are some cases in like I recently visited the US for the user conference of anatomy, and there were some professors came from deans, in fact, from Mayo Clinic from US, from Cleveland Clinic and things like that. So they were saying there is a case for a small baby who was having difficulties in breathing. Okay, so they were unable to track what was the problem. Then using this particular tool, measuring tool, they tried to track the area of the trachea of the baby, and they found that it is a natural, like by birth it's an abnormality in her trachea. It's a like 5-6 years old baby. So before they perform any surgery or something, they want to make sure that that is the problem. So by using these tools, they concluded that there was a problem in the air space, due to which she is having problems in breathing. Okay, it's not an asthma or anything, but due to the problem, because it's naturally when she was born that was existing, and as she grows, she was having difficulties in breathing. So using that particular tool, measuring tool they call it, they found the case and whatever the procedures they have performed, and they said they saved the life of the baby. The most important is at the end of the day, they save a life, you know. If you want to remove any, like as I said, this is, and you can use, this is basically an angle. If you want to show that this particular rib is not at a particular angle, and you feel that that is not even, and I personally feel that it is not the angle is not good, then you can use this particular using. So you can have an angle, you see. .45 degrees, something like that. Okay. So since it is like that, it's 43 degrees. It's not 45 in that. Okay. Or any specific. And if you want to delete everything, you can just press this. All the labels which you have placed, it will go off. Okay. The other one is. This is basically the same thing. Again, you're trying to see the different sections you're trying to see, you know. You see, different sections you're trying to see it. Instead of making a cut, if these are basically instead of you cutting it, it's the ready-made options they have it. So if you want to make a section just through half of it, instead of using the tool, just go there, click half of it, the body will be half.
Symmetrical parts.
Yes. Yeah. This is freehand dissection tools. This is very specific for the skin, or any specific cuts you want to make in different angles. Okay, but you have to be very specific. You can't make a cut zigzag or something like that. You have to be very specific what type of cut you want to make it, and it should be relevant to your procedures, actual procedures. I mean, when you performing an operation or something, it should be relevant to that. So it will try to make a section and let you see the same way how we cut it, and see what are the different parts you can see using that section. This is the cut tool, as I said here. You can just cut it. This is the presentation which I was mentioning you. Okay. For example, I want to save this particular image now. I click 1. 1 is basically that image. Okay. So you can save this one. You can save these images in 1, 2, 3, 4, 5.
And when you return,
yeah,
The picture will
exactly.
enhance.
Yeah. You can do the same thing, like we